You know, if you sit on your leg for too long and it falls asleep, and then finally when you're trying to get sensation, it just feels like it aches a little bit, but yet you can't really feel anything, so that's how it feels. Around the nipple itself, absolutely nothing. Like, I think one day I pinched as hard as I could and felt absolutely nothing. So it's like, okay, there's nothing here.
So I wear a prosthesis, and I'll forget to put my boob in. And I'm at the gym, and I'm like, oh man, one side's lopsided. I don't have sensation, I would say, from right here to about a little under my armpit.
I always feel like I have a tight jog bra on. It doesn't hurt, it's not uncomfortable, it's just there, you know it.
Driving, putting the seatbelt on, sometimes I can't find a comfortable spot. You don't feel anything.
Breasts move, they bounce, they float in a swimming pool, and they help a person know where they are in space. In addition, of course, for many women and their partners, the breasts play a very important role in sexual function. In the United States alone, 100,000 women a year have one or more breasts removed. What women know about sensation or what to expect for sensation after mastectomy really varies. Sometimes women don't even know to ask questions about that, and they don't realize that they're going to have a loss of sensation. And it relies a lot on the quality of conversation and communication with the surgeon.
One of the things that my patients find surprising when we're talking about a mastectomy procedure is really the scope of that surgery. The breast itself goes all the way up to the collarbone and down to where the breast fold is, and then of course to the midline and out to the side. We operate in that entire area. All of those nerves that travel through the breast that go to the skin are cut. What this can do is it can interrupt the ability of that skin and nipple areolar complex to feel touch, to feel temperature, and result in the patient experiencing numbness that's generally permanent. Some patients notice a little bit of improvement, but largely patients, once they have numbness after surgery, it doesn't resolve, it doesn't get better. So in that instance, it really is more about the patient getting used to it, their body adapting to a new normal rather than regaining sensation after surgery.
That nerve that was going to the nipple and was going to the skin has been removed, but there's still a cut piece of it along the chest wall. So now you have basically no capacity to feel or to have sensation, but still all of that capacity or that perception of pain at that cut nerve end. So when we talk about patients may have numbness or they may have a loss of sensation after surgery, a lot of times they equate that with, oh, then I won't have pain, or I may not have pain, and that's unfortunately not true. I think one thing that has struck me as I started talking more about sensation with patients is how important it really is, and they don't always bring it up. So my advice to the surgeons out there that might be watching this video is to discuss it. This is something we know is going to happen. You have to cut those nerves. We know they're going to have a change in sensation, and I think that that's not necessarily a complication, but it is a byproduct of the operation, and they should know that.
Nipple erection is an important part of the sensation and pleasure that a woman can feel during sexual activity. And the responsiveness of the nipple to a partner stimulation is an important part of their sexual response and physiology. So loss of nipple erection for some people can feel as significant as loss of erection or sensitivity or responsiveness of the clitoris. Or men can relate to imagine what would it be like to lose the erection ability of the penis.
It was the point of the nipple erection that I was more worried about, that if I don't have that, will I be able to orgasm? Will I be able to be more intimate? Will I find that connection?
You never think about what does your breast mean for you during sex. It just happens, but when you're going to lose your breasts and you do, then you're like, wow, yeah, that really was important to me.
The loss of breast sensation can be very distressing and will vary from person to person. We all have a need to feel touch, which can be a source of pleasure, as with intimacy, but also a source of comfort, as with a hug.
It's just different now. So now even my son knows if we're cuddling and watching a movie, he'll put his head on my right side versus my left side.
A lot of times we may skip over something or not bring it up because we're kind of going through the process and thinking about 10 different things at once. And it's not because I've missed something or because I'm trying to hide something. It's because, that's not the direction that the conversation may have gone. And so I think it's always helpful to me when patients come in with a list of questions, but they always will apologize for it. And I always tell them I would much rather I know what's on your mind and what's important. And even if that takes a little extra time, at least I know we're hitting those points.
I think we often, as providers, shy away from the kind of the most extreme details of it because we're worried about, scaring our patients unnecessarily or giving them too much detail. But I think, in fact, our patients are asking for more detail about what their body's really going to go through so that they can prepare for the after effects of that.
I think the biggest advice I can give patients is that they need to listen to all options. Because a lot of times when you hear cancer, it clouds everything else, right? And the only thing you can think about is getting rid of it and not dying, right? But then, you don't think about life after that point.
Ask maybe one question, start there.
I would say what really helped me get through it was my surgeon just provided space and really was open to hearing my concerns. And she didn't see me as a number.
I think everyone's situation is different. It's what you're facing and it's, what you can handle. If you have support, then you can get through anything.